The big thing with all of our treatment programs is they're always based on the 3 phases of healing. So all your job is as a doctor is to come up with the right diagnosis. And once you've got the diagnosis, then you figure out which phase of healing they're in and what are the complicating factors. So based on those 3 variables, the diagnosis, which phase of healing, and the complicating factors, you can custom fit a tailored program. And the general rule is if they're in the inflammatory phase of healing, you're gonna treat daily. The big problem with inflammation is that it causes damage to the joint. You want as little, the acidity of it, the phagocytes come in and they're removing debris and so there's 2 reasons. One is the acidity and the phagocytes start eating up healthy tissue and causing further damage to the area. But also, the more inflammation there is, the stronger the repair response is. And we want a strong, solid repair response, but you don't want to produce excessive scar tissue for the area. So, and those are the 2 concerns. So we're treating daily, and of course the treatment is primarily adjustments with rest and try and mobilize the joint without irritating the joint. So anytime a patient comes in, if I haven't seen him for 6 months or a year, the first thing they do, they go, I'm in pain. I'm going, okay, we're gonna treat you daily, probably for the next 3 or 4 or 5 days in a row. And then we'll see how you're doing. As soon as their pain drops to a significant level, usually like a 2 or a 3 on a scale of 1 to 10, we know the inflammation's under control. Now they're in the repair phase. Any questions about the inflammatory response? It's daily. Someone comes in, they're in pain. I look at them and, all right, you're in pain. We gotta adjust you today, tomorrow, and the next day, then we'll see where you're at. Typically the inflammatory response is only 1 day of active inflammation, but it usually takes 2 or 3 days because it has a big burst and then it fades away. The repair phase is typically going to be, it peaks at 3 weeks, but the repair phase can be anywhere from 3 weeks long up to 12 weeks long, depending on your age. So if you're a small child, they're going to do the whole repair phase in 3 weeks. If you're 60 years old, it's going to be 10, 11, 12 weeks. If you're on medication or you have arthritis or it's a bulging disc and it is a chronic condition, it could be even longer than that. Of course, the biggest concern or the biggest complicating factor is going to be re-injury. Are they following your instructions or are they going back to work because they gotta feed their family? So you take all those into consideration, but the general rule of the repair phase, it's gonna be anywhere from 3 to 12 weeks. Number 1 variable is gonna be their age. So if they are young, I'm gonna recommend a 4-week program for the repair phase. If they're old, the standard, if they're anything over 30 to 70, I'm gonna start at 10 weeks and then push it down to 8. If they're a little bit younger, push it up to 12. If they're a little bit older, again, that's one of the big factors. And then the 3rd one is the degree of arthritis. How much, is this an old injury, is it a new injury? If they've had the problem for 10 years, and they're just now getting it treated, I'm gonna push it out an extra 1 or 2 weeks. But typically, age is the big one, and then we kind of modify it from there, right? Any questions about that? During the repair phase, the primary treatment is traction and adjustments and exercises. We emphasize the traction because, number 1, that tends to be the most aggressive way to stimulate scar tissue. It is the best. I always put it on a scale. So the repair phase, remember, in the first 3, 4, 5, 3 weeks, the adjustments are very helpful because they're so gentle. Adjustments are gentle, you're not damaging the joint, and you're creating massive mobility. But they don't stimulate the area half as good as traction does. So in the beginning of the repair phase, we're doing lots of adjustments, and the traction we're doing every visit, but we're doing it very gently, very carefully. Because it's so aggressive, it can actually damage the joint if you're too aggressive. Same thing with the exercises. But then, as the repair phase goes on, near the end of the repair phase, the traction is doing 75 to 80% of the work. The adjustments become way less important. And I always tell people the exercises probably contribute to about 25% of the success. So overall in the repair phase, the traction's doing 50 to 60% of the work. You're gonna get good results if you do traction. And we consistently have patients come in and they go, yeah, I've been going to chiropractors my whole life. And we say, hey, have you tried traction? And they go, no. And so they sign up for a rehab program and they go, I've never felt this good. This pushed me over the top. This made all the difference. Remember, it's a repair phase thing. So it really doesn't come down to what's gonna make them feel better faster. The traction doesn't make them feel better faster. It just takes them to a whole new level by the end of the program. It's kind of the same way, I bet, if you, like me, when I first started, all they pushed was adjustments. When I just did adjustments on people, I could get great early results, but then my results would taper off over time. When I added traction to it, man, so it's always adjustments are primary, rest, no traction, no exercises in the inflammatory response. We keep doing adjustments in the beginning of the repair phase, we taper them off as time goes on. You know, when I was in school too, they taught, do 3 adjustments at first, then you switch it to 2 adjustments a week, then you do it to 1 adjustment a week, which would be 3 adjustments a week here, which I don't think is enough, 2 adjustments a week here, which is kind of appropriate, and then 1 adjustment a week during the remodel phase. We're just, instead of tapering care down, we actually increase care, but it's different kinds of care, okay? Remember, in the remodel phase, what's actually happening in the repair phase, your body's producing type 3 collagen. It's a temporary, poor quality scar tissue. And the reason your body uses the type 3 collagen in the repair phase is because it's plastic. It responds very positively, very aggressively to stimulation. So in other words, your body is just slapping the scar tissue into place, and the amount of stress you put on it determines how it becomes organized. The body's like, we're gonna throw it into place. Every time you stretch it, we're gonna reorganize the tissue. So all the care we are doing is to reorganize the type 3 collagen into the highest quality collagen we can get. And then in the remodel phase, the body goes back and replaces all the type 3 collagen with type 1 collagen, which is the stronger, more permanent stuff. The good news about type 1 is it's 30% stronger than the type 3. So just by going through the remodel phase, you increase the strength of the joint by 30%. The downside is that once this type 1 becomes switched over, now you've got permanency. Type 1 does not respond to therapy, rehab, and that's why a lot of these people who come see us with arthritis, we can double the strength of it, but we can't get it anywhere near. Like I tell patients, if you have a simple injury and you rehab it, the best you can get is 80% strength. That's if you rehab it perfectly and it's a simple, uncomplicated injury. If you have a complex injury involving more than one joint or more than one ligament, you can't even get 80%. You'll be lucky to get 60%. If you don't treat it perfectly, you're gonna get 50 or 40%. So a lot of these patients, when they come to see us, the quality of this old joint, this old injury that's been damaged for, 10, 15, 20 years or more, is at 10 to 20% of what it originally was capable of. And we're gonna take them from 10% strength to 20% strength. And they're gonna love it, it's gonna feel great, and they're gonna be amazing, but because we reduced the inflammation, we doubled it, it's twice as strong as it was. So it's not firing all the time, but it's 20% original strength. That's the best we're gonna get, maybe 30%. So, it's that balanced expectation. So anyway, the point of the remodel phase is, and remember, this is a 6 month to 2 year process. 6 months to 2 years. And this is what people would typically call wellness. So we've got 6 months to 2 years, and the main thing you're trying to do, there's 2 things that happen that are bad in the remodel phase. One is you get contracture. That's where the scar tissue actually shrinks. So that works good on your skin. The idea is that you got this big ugly scar, it's big and red, and then you watch it over a 1 year period, and it will shrink. And then it turns white, or it turns, it goes from red. It's red during the repair phase because of all the blood vessels, and it's metabolically active. In the remodel phase, it shrinks and becomes white because it goes back to being more inert. And the problem with shrinkage is great on the skin, it tightens it up a little bit. It's terrible for a joint where you need mobility, flexibility, and strength. So you can influence the remodel phase. What we want to do is we want to accelerate the turnover. We don't want any of this type 3 collagen left. Any of the type 3 collagen here is going to be a weak spot. So the key is to keep stimulating it. Now, do adjustments stimulate it? Yes, they do a great job stimulating the area and encouraging the rollover. That's why we do a once a week or a once a month adjustment. Traction, very, very, very stimulatory. Exercises tend to work almost as good. They're not as deep. You can't go near, because there's no creep involved with exercises or stretches like there is with traction. So traction is probably the best, but the idea of them doing traction every day for 2 years probably isn't going to work. So what we do is we emphasize the exercises because this is something they can do at home, because it's going to get 80 to 90% of the results. So if I just had you doing yoga or specific exercises like a pre-core or the take-home exercises versus a daily adjustment and traction, you're still going to get 80% of the results doing the stretches at home as if you were coming into the office every single day. And it's something you can do at home. So in the remodel phase, typically, you're going to say if they're a young kid and it's an uncomplicated injury, you'd say come in once a month. If it's an old person with tons of arthritis, then you're going to say come in once a week. And you can call it a wellness program, you can call it whatever you want. Most people don't like the idea of wellness. I'm coming in to maintain my health. About 10% of your patients are going to love the idea of coming to see you because they think you're cool, they love the way they feel, they like the adjustment. So you should always have 10% of your patients who just go, Joe, you're an amazing guy. I feel good every time I come see you. I've got the money, I care about my health, I want to do it. And that's great. So you should always, and you should say, great, that's an ideal situation. But instead of selling wellness to every single patient, I was taught in school, every person needs chiropractic every week for the rest of their life. The public doesn't buy that for the most part. You're gonna bang your head against the wall. So what we train you to do is make sure they understand that actually, no, we're not trying to get you to come in here once a week for the rest of your life so I can have a steady paycheck and retire wealthy. I'm trying to get you to come in for the next 6 months to 2 years, because if you consistently do exercises at home and get an adjustment once a week, you're going to increase the strength of your damaged joint by 30%. If you do nothing, it'll probably go up 10 to 15% on its own. I don't really emphasize that, but that's the truth of it. But I can double the improvement. I can double your results in the remodel phase. I can add an additional 15 to 20% strength to your joint if we treat you during the remodel phase. And about 50% of your patients will be like, I want an extra 15. This is a chronic injury. This is a big problem I've had for decades. I definitely want to do remodel phase healing. And then you recommend an appropriate program based on their complicating factors. So, any questions about that? Bottom line is daily for inflammation, 3 times a week for the repair phase, and then once a week or once a month during the remodel phase. The other thing I do here too is I don't typically recommend 2 years. If the patient seems open to it and seems like that's what they want, then that's what I'm going to do. I really strongly push hard for once a week or once every 2 weeks for the first 6 months. Because remember, the remodel phase is still a phase. So if you look at it, it kicks in way back here in the repair phase. It peaks about the 3-month mark, and then it fades off. So this 30% improvement that they're gonna gain, most of it is right here. You're really gonna get 25% of the benefit of the remodel phase in the first 3 months of the remodel phase. That last year and a half, you're going to get a 5% improvement. So really, the exercises work the best for 3 months in the remodel phase. So it's adjustments, traction and exercises and adjustments, exercises with a little bit of help from us for 3 months, and then they've got 90 to 95% of the benefit. You follow that formula, you're gonna get the absolute best results possible for your patients.